एसएसओ कैंसर अस्पताल द्वारा हेड एंड नेक सेंटर ऑफ एक्सीलेंस केंद्र की शुरुआत। इस केंद्र द्वारा आधुनिक सर्जरी, विशेषज्ञों की टीम, रिसर्च और प्रशिक्षण की सुविधा एक ही जगह उपलब्ध होगी। मुंबई कैंसर मरीजों की बढ़ती संख्या को देखते हुए हेड एंड नेक कैंसर से पीड़ित मरीजों को एक ही जगह इलाज उपलब्ध कराने के लिए एसएसओ कैंसर अस्पताल द्वारा हेड एंड नेक सेंटर ऑफ एक्सीलेंस केंद्र की शुरुआत की गई है। इस केंद्र में मरीजों को अत्याधुनिक सुविधा उपलब्ध कराई गई है। सेंटर का औपचारिक उद्घाटन दक्षिण अफ्रीका के पूर्व क्रिकेटर और अस्पताल के ब्रांड एम्बेसडर जॉन्टी रोड्स की मौजूदगी में किया गया। इस अवसर पर अस्पताल के वरिष्ठ डॉक्टर, मरीज और उनके परिवार के सदस्य भी मौजूद रहे। एसएसओ अस्पताल में मुंह, जीभ, गले, वॉयस बॉक्स, थायराइड, लार ग्रंथियों, स्कल बेस और अन्य जटिल हिस्सों के कैंसर का इलाज किया जाएगा। सेंटर में मरीज की बीमारी और जरूरत के अनुसार व्यक्तिगत उपचार योजना तैयार की जाएगी, जिससे इलाज में देरी कम हो और रिकवरी बेहतर हो। ये सेंटर आधुनिक सर्जरी, नई मेडिकल रिसर्च और विशेषज्ञों की मदद से बेहतर कैंसर उपचार पर ध्यान देगा। साथ ही मरीजों और मेडिकल प्रोफेशनल्स को कैंसर से जुड़ी सही जानकारी और प्रशिक्षण भी दिया जाएगा। भारत में हेड एंड नेक कैंसर के मामले काफी अधिक हैं और इनमें से कई मामलों को तंबाकू व सुपारी से बचाव और समय पर जांच के जरिए रोका जा सकता है। 2023 के आंकड़ों के अनुसार पुरुषों में होने वाले कुल कैंसर में करीब 26% और महिलाओं में 8% मामले हेड एंड नेक कैंसर के थे। वहीं GLOBOCAN 2022 के अनुसार भारत में होंठ और मुंह के कैंसर के 1,43,759 नए मामले और 79,979 मौतें दर्ज की गईं। इनमें करीब 70%-80% मामलों का संबंध तंबाकू और सुपारी के सेवन से बताया गया है। ये आंकड़े समय पर जांच, शुरुआती लक्षणों की पहचान और तुरंत विशेषज्ञ से सलाह लेने की जरूरत को रेखांकित करते हैं। इस सेंटर में हेड एंड नेक कैंसर के इलाज के लिए अनुभवी विशेषज्ञ डॉक्टरों की टीम है, जिसने मिलकर 1 लाख से अधिक सफल सर्जरी की है।
A very good center that takes very good care of the patient and very standard quality. So that's how we started our center, and our first center where we do the organ specific surgery, different organs with different specialties, and that's what the dream. Our dream is that each organ should develop the center of excellence. So one of the first starting in our birthday. So congratulations to Amit and thanks to Jonty for inaugurating this session. So that is the one start. I think we will be covering each and every department like a center of excellence, and we should be doing good. And at the same time when we are doing good, we want to support, of course, the poor and needy patient also. So we will be, as they have declared, we will be doing the free surgeries also. So we can reach out to the tier 2, tier 3 cities, or that we can help them who needs the. Because during our studies also, since then, my dream especially has been where the most cancer treatment needed at the lower level, at the village level, tier 2 level, where they should get the same kind of treatment. So that's our dream. I think we will achieve gradually doing that. Thanks a lot. Thanks.
Thank everyone who has joined for this initiative. And you have seen the incidence of cancer is growing in India. And if you see, head neck cancer comprises almost 25 to 30% of overall cancer bulk. And in that particular thing, what we want to create in our society is first to create awareness that every person, those who are having any doubt in terms of non-eating ulcer in the mouth, should reach to a right step at a right point of time. The early they reach, the better they are. So we want to create practically door-to-door awareness in every corner of the city, right from tier 1, tier 2, tier 3 cities. And by creating a center of excellence, apart from this cancer awareness, we are creating a subspecialty in head and neck cancer, a department which is focused in performing oral cancer surgery, a clinic which is focused in performing thyroid cancers with recent innovations like using robotic technology. Similarly, laryngeal cancer using innovative techniques like laser technology. So, and the base of skull in a minimally invasive way. So you might have heard a single cancer surgeon performing everything, but now the concept and the era is changing. You cannot do everything. You have to be focused in one specific field. Like John T, he's very much focused in taking catches in a beautiful fashion in different angles. So a surgeon, it is very difficult to perform all the surgeries right from head to toe. So I'm focused as a surgical oncologist in performing head and neck cancer surgery. And that too, with creation of this subspecialty, my entire team is going to focus on one specific area where they will be trying to provide top of the notch services which is being available all across the globe, so that Indian patients don't have to travel outside the country for the treatment, which we can provide in a best manner and at an affordable rate. At the same time, we are definitely concerned towards the patient, those who are coming from a poor socio-economic strata. So we are going to help them out by providing surgeries at free of cost. So we reach to masses, and we want to declare like how tuberculosis was there previously. People were threatened that TB हो गया तो अभी इसे मरना ही है. But TB से अभी everybody can get cured. They know that they have to take simple pill for 6 to 9 months. So our awareness should be so strong that this fear of cancer, which they feel that cancer हो गया तो मैं मर जाऊंगा, cancel हो गया means I'm cancelled in my life, it should be vanished away from their mindset. And we want to create that. Get yourself diagnosed early, get treated early. The shorter the journey, best is the outcome. Now with recent innovative techniques and technologies, we can predict which type of cancer an individual can have, what sort of genetic predisposition they can have, and if they do lifestyle modification and focus in that specific organ, then they might get themselves cured of cancer in very early stage, that is stage 1, where they might require only single modality treatment. So I want that every individual, they should not fear from this word cancer, and the most important message is that prevention is always better than cure. If someone is addicted to different sorts of addiction or vaping, to refrain yourself, it's all or none phenomena, nothing in between that. So stop addiction, keep yourself healthy, and live a healthy life.
Thank you, Dr. Chakrabarty, for sharing the vision.
Everybody fine?
Yes,
Good.
thank you.
Yes. Thank you very much for being here today. Thank you for your patience in waiting to speak to us. I'm not a specialist when it comes to cancer. When I talk about centers of excellence, it's usually around cricket and catching cricket balls or hitting cricket balls. But what Dr. Amit spoke about, the subspecialty for me is so important. If I think back to my cricketing career under in the late 90s for South Africa, we were blessed with 3 brilliant all-rounders: Jacques Kallis, Sean Pollock, Lance Klusener. And now what we see in T20 cricket, how the impact player has changed, that the all-rounder is being phased out, because you see the difference when somebody who is a specialist batter, the difference they make batting at number 7 or number 8 sometimes. Suddenly the scores are going past 300 almost in T20 cricket on regular occasions. And that for me, I haven't yet experienced in my family, lost through cancer, so it's not something that is close to my heart. But I live in India for 5 months of the year. So myself, my family, I'm never a visitor to India. And I do understand some of the real issues that are facing this beautiful country. So when it comes to cancer and the awareness of it, I'm not an expert. So I've prepared a small little presentation or talk. Is that okay if I read it? You don't mind? Because I don't want to get it wrong. Being a non-cancer specialist. All right. So people often ask me what makes a great team, and these things I understand. Is it talent or is it preparation? But in my mind, is it for the ability to work together towards one common goal? And this common goal is about specializing, subspecializing in head and neck cancer, and also making it available to more and more people throughout India. And it's not just for people who can afford it. So that's our common goal, and I believe that is what is so important. It's a combination of all of these. It's not just the talent or the preparation. It's all of that, plus having an incredible common goal. And after spending time with this amazing team at SSO Cancer Hospitals, I've realized that the same principles that build a championship cricket team are also principles that build exceptional healthcare. And that's exactly what today represents. Not simply the launch of a new center, because like I said, centers of excellence for me, I'm accustomed to cricket fields, but the coming together of expertise, innovation, and compassion with one shared purpose: to give every cancer patient the very best chance at life. Throughout my cricketing career, I learned that the best victories are rarely achieved by one individual. Sure, you can have great players in your team, but they are built by teams. Healthcare is no different. Behind every patient is a team of surgeons, oncologists, nurses, rehabilitation specialists, nutritionists, caregivers, and most importantly, families, all working towards one goal. When everyone plays their role, remarkable things can happen. That is exactly what impressed me most about SSO Hospital. When people hear the word cancer, the first emotion is often fear. And that fear is because of lack of understanding. But today, I hope we replace fear with something more powerful. And that, like Dr. Amit said, is awareness. Because awareness encourages people to seek help earlier. Earlier diagnosis creates more treatment options, and better treatment means people have the opportunity not only to survive, and I think that's the most important thing, but to continue living the life that they love. That is so important. Because one thing I've learned through my association with SSO is that treating cancer isn't only about removing a disease. It's about helping people return to their families, to their work, to their confidence, to the everyday moments we often take, and all of us take for granted. That's why today's launch is so meaningful. SSO's Head and Neck Center of Excellence is bringing together specialized expertise, advanced treatment, education, research, and long-term patient support under one platform with a clear vision of improving cancer care for patients across India. I also admire that the center is looking beyond today's patients. It is investing in education, training future specialists, supporting research, building stronger referral networks, and creating a community where doctors and healthcare professionals can learn from one another and continuously raise the standard of care. That kind of long-term thinking is what creates a lasting impact. To Dr. Amit, the entire clinical team, and everyone at SSO Cancer Hospitals, congratulations on bringing this vision to life. I'm proud to be associated with an organization that believes healthcare is about so much more than just treatment. It's about education, innovation, collaboration, compassion, and most importantly, giving people hope. I wish the Head and Neck Center of Excellence every success in transforming lives and setting new standards for cancer care across India.